The beleaguered COVID-19 testing and test and trace system suffering yet another setback. A technical failure which has left nearly 16,000 cases in England unaccounted for, their contacts uncontacted. And once again, the Health and Social Care Secretary called to the House of Commons to explain how on earth this happened.
This is an ongoing incident, and I come to the House straight from an operational update from my officials. On Friday night, Public Health England identified that over the previous 8 days, 15,841 positive test results were not included in the reported daily cases. This was due to a failure in the automated transfer of files from the labs to PHE's data systems.
The system was already in trouble, people unable to access tests or having to travel miles, but this was on a different scale.
That means as many as 48,000 contacts not traced and not isolating. Thousands of people blissfully unaware they've been exposed to COVID, potentially spreading this deadly virus at a time when hospital admissions are increasing and we're in the second wave.
So what happened? The tests are processed by the Lighthouse labs and positive cases are transferred to a centralised Excel spreadsheet overseen by Public Health England. This in turn is meant to flow into the test and trace system where contact tracers can then begin tracing and advising people to self-isolate. But the spreadsheet filled up and couldn't take any more cases, a technical issue which went unnoticed between September the 25th and October the 2nd, although 75% of the cases were in recent days. But Channel 4 News has now learned that as the system was being set up, there were warnings to bring in data experts and not to use an Excel spreadsheet. This change in the number of positive cases dramatically alters what we know of the spread of the disease in England. On October the 2nd, the positive case figure was 6,968. The additional 4,786 reported means the figure is now just under 12,000. It has largely impacted the northwest. In Manchester, they thought they had 223 cases per 100,000. In fact, it's nearly 500 per 100,000.
Clearly, the impact was significant. I was informed yesterday. We did know from our student outbreaks and some of the data we were getting from the universities that there was a mismatch between the data I receive on a daily basis and the actual number of cases being reported by our university colleagues. So we knew something was missing, but the scale of the gap was a real shock.
Mr Regan added it was not fair to blame Public Health England and said the government needed to provide more answers. It has also now emerged that a drug used to treat the President of the United States is in short supply in the UK and is having to be rationed.
We are monitoring him very closely for any evidence of complications from either the coronavirus illness or the therapies that we are prescribing.
Remdesivir, given to President Trump, is an antiviral drug manufactured by Gilead, and when preliminary results showed it reduced time spent in hospital, the US bought up most of the world's supply, which means they've now issued an alert here.
It's much more restricted now. It's only for people who are hospitalized, who have pneumonia, who have low oxygen levels. Now, when Donald Trump was first treated with remdesivir, he didn't have all of those three.
Is there a way around this?
There are huge amounts of this drug being made by companies in India, in Bangladesh, in other countries. But at the moment, there's a legal restriction where they're not allowed to send drug into countries like the United Kingdom, despite this medical emergency, despite this shortage.
The Department of Health and Social Care said it was expecting more supplies at the end of October and that the restriction on eligible patients should only be temporary.
Victoria MacDonald. Well, now, despite being under strict local lockdown measures for weeks, Manchester now has a higher infection rate than any other authority in England. The new revised figures show that 1 in 200 people are getting infected every week. That's the highest ever recorded during the pandemic. Local mayors are urgently demanding more control over test and trace. Our North of England correspondent Claire Fallon is in Manchester.
Well, John, not only has the number of cases in Manchester more than doubled in the space of a week, but the infection rate is now, according to the very latest data this evening, above 500 cases per 100,000 people. And to put that into context, that is 10 times the rate that just a few weeks ago we were being told was enough to trigger a local lockdown in the area. And all of this, as you say, while Manchester is in a local lockdown, as it has been for 2 months now. I'd like to be able to give you a simple, clear reason. I think in reality there are a number of factors at play, but clearly a significant factor is the return of universities based upon information we've been given this evening from the City Council. They've told us that more than half of the most recent cases are among 18 to 21-year-olds. Manchester University this evening has told us that in the first 2 weeks of term, more than 800 students have tested positive, and that is just one of the universities in this city. But of course, that also means that there are many hundreds of people who are not students who've tested positive. I think in reality, over the last 2 months with the restrictions in place, people have not seen the numbers coming down, and I think that has led to some frustration. And going forward with the data issues and the missing cases, inevitably that will mean that a number of people, quite a lot of people you would think, who've tested positive are now not having their contacts traced for a period of time. And so over the coming days, what impact that will have will be alarming people.
Claire Fallon. The Welsh Government says it may impose quarantine rules on people travelling to Wales from COVID hotspots elsewhere in the UK. Wales's Health Minister said this lunchtime the approach was under active consideration. The Welsh Conservatives described it as a dangerous slope to go down. Our Home Affairs correspondent Andy Davis joins us now from Chepstow.
Krish, are we about to see a situation where if someone who lives in a COVID hotspot in England who wants to travel across this bridge for a holiday here, for instance, in this part of Wales, which isn't in a form of local lockdown, they're then going to be told to quarantine for 2 weeks as a result? Well, that's the dramatic move the Welsh Government said today that it was considering. And if you live in that particular area, you have to, if you live in that part of England, you would have to quarantine if you came to this part of Wales. Take Monmouthshire, where we are, for instance, at the moment, relatively low levels of coronavirus. If you live in another part of Wales with local restrictions, you can't leave that area to come to this part of Wales, for instance, without a reasonable excuse, such as for work or for education. But if you live in an equivalent hotspot of England, you can come here. It's something that Plaid Cymru has raised with the Prime Minister repeatedly, saying it exposes areas like this in Wales to an unfair risk of infection. The First Minister, Mark Drakeford, has urged Boris Johnson to adopt a Welsh model and institute similar travel bans for areas under local lockdown in England. But the Prime Minister isn't keen to do this. So it brings us, after all, to today's press conference with the Welsh Health Minister, in which he said that he and the First Minister, Mark Drakeford, are now trying to work out what to do next. And one of the ideas they had was to look at quarantine regulations for international travel. So I asked him to clarify that point.
Is the Welsh Government actively considering imposing some sort of quarantine regulations on people coming from high incidence areas of England into Wales?
From high incidence areas across the UK, yes, we're actively considering it.
And what might be the timetable for that, just as a follow-up?
Well, the timetable for that will be we'll have to consider the matter today. We'll need to take some advice from our scientific and medical advisor, public health advisors here, and we'll then need to consider whether this is the right course of action.
A dangerous slope to go down is how the Welsh Conservatives described it today. It certainly would be a very significant moment if it came to it. Lots of questions raised by this, not least importantly, under what powers it could be introduced, how would it specify areas in the rest of the UK which it would apply to, and then how would it be enforced. But a source within the Welsh Government this evening said to me that it was under active consideration and it was no idle threat, they added.
Andy Davis. Now, the European Commission President, Ursula von der Leyen, says she's self-isolating after coming into contact with a person infected with coronavirus. Amid a surge in infections elsewhere in Europe, the French government has put Paris under maximum alert, closing bars and banning festive gatherings for at least 2 weeks. In Italy, where cases have soared to their highest level since April, new restrictions are being considered, including limits on social gatherings and making mask wearing compulsory outdoors.
Well, Victoria joins us now from the newsroom.
Yes, you can say, sorry, John, that the WHO was talking today about the number of cases that they now believe there are worldwide. So the official figure has always been 35 million. Today, they put it at 800 million, which sounds an awful lot. It is an awful lot of coronavirus cases, but it is only 10% of the world population. And today, the executive director of the WHO, Mike Ryan, said that it means that the vast majority of people are still at risk. And we've just heard throughout this programme the number of different countries who are really scrabbling to deal now with second waves, with outbreaks of this virus.
What happens when you, as you reported earlier, when the drugs are in short supply?
Well, Mike Ryan also said we have the tools to suppress the transmission. Now, part of that means test, trace and isolate. And as we see here, we've got problems with that system. It also means the washing your hands, wearing a mask, keeping your distance. But he was also talking about drugs like dexamethasone, which were discovered here in the UK to be really useful tools against COVID-19, and also remdesivir, which I was talking about earlier. Now, therein lies a problem because, as I mentioned earlier, remdesivir, the supplies were largely bought up by the United States. Now, today, it's not just us who are finding that they're in short supply. Across Europe, there are problems with it. The European Union has just had to send some supplies to the Czech Republic, for instance. And this is going to cause a problem if Gilead, who manufactures remdesivir, can't continue to supply wealthier countries. There are some generic manufacturers, but this is a theme that you do not want to establish itself during the virus. You need to be able to treat everybody who needs it with the drugs and the tools that are available.
Victoria MacDonald. And as we've been doing almost every day for the past weeks, we have asked to speak to someone from the government about the COVID-19 crisis. But nobody was made available.